Hey everybody, welcome back to Bestie Health. Dr. Michael Braun here, your cardiologist, internist, and healthcare advocate trying to teach you to stay healthy and stay well. Today we're going to talk about a great topic, a topic that's actually been in the news lately, and that is vitamin B12. It's been in the news because it's been determined that about 80% of the people in this country are deficient, and yet it's extremely important. It's actually been known as the bookend vitamin. Why? Because it's very important for both the beginning of life as well as the end of life, but it's actually also important in between as well. So we're going to go through why vitamin B12 is so important, what effects it has on our biology. I'm also going to talk about why people are deficient, how we can get more of it into our system, and the downside of not having enough vitamin B12 in your system. So let's start off with why it's so important. Well, there's many reasons. I'll go over a few of the most important ones. Number one, it is vital to make red blood cells, which is your blood. Prevents anemia when you have adequate amounts. When you don't have adequate amounts, you become anemic. Two, neurologic health. We've seen a lot of elderly people, or even older people, who have a lot of neurologic deficits, and it's been attributed to B12 deficiency. Three, bone health, muscle health, bone growth, bone strength, and even bone remineralization has been attributed to adequate levels of vitamin B12. Number four, DNA synthesis. You don't have to be a biologist to understand what DNA is. That's our genetic material. Without adequate amounts of B12, we really can't produce adequate DNA stores. Another big important reason is just cellular energy. People that have low B12 levels are people that have much less energy, they're sluggish. Even it's been known that athletes who have optimal B12 levels perform better when needed to be. It's extremely important not only for neurologic health, which I just mentioned, things like memory, but it's also extremely important for mood. People that have vitamin B12 deficiency have a much higher rate of depression and anxiety. Your hair, your skin, your nails are very vitamin B12 dependent. Macular degeneration, which is a very common eye disease these days, is being often attributed to deficient vitamin B12 levels. So you can go right down the line, whether it's your brain health, whether it's muscle health, whether it's bone health, whether it's mood and anxiety, whether it's blood production, preventing anemia, eye disease, energy production, DNA production in the cells. We need lots of vitamin B12 to do all those jobs in our body. And yet a major proportion of people in this country are vitamin B12 deficient, and that's multifactorial. Now, number one is probably because there's not a lot of B12 in foods. The only good B12 sources are actually coming from animal products, such as meats, fish, chicken, dairy, cheeses, things like that. So obviously, if you're a vegetarian or a vegan, you're going to be B12 deficient. Other than fortified foods, there's really very little B12 in other sources. These are the reasons why people are generally B12 deficient. Age is a big reason why people become deficient, meaning people just don't absorb B12 as we get older. Number two, if you've ever had any GI issues, if you've had surgery on your colon, whether it's bariatric surgery or even have things like colitis, you're not going to absorb B12. There's actually a disease that we don't hear about that often anymore called pernicious anemia, which is an anemia associated with poor absorption of B12. And again, that is age related. There are actually medications that people take, which are actually very common. One being something called metformin, which is a very commonly used drug for diabetes. People do not absorb B12 in that setting. One of the most common drug classes in America is something known as a proton pump inhibitor, and comes under the names of omeprazole, Protonix, Nexium, and others. And people that are on those medications have very poor B12 absorption. And some people just don't absorb B12 even when they take it orally, and that has a lot to do with what I mentioned to you about certain cells in the stomach and in the colon that are responsible for B12 absorption. And many people either lack the absorptive capacity or they've had other medical issues that don't allow absorption. Now, how do you replace B12? Well, I mentioned some of the foods. So animal products and animal proteins are really the only good source of B12. But even in the setting of a good animal-based diet, many people are still vitamin B12 deficient. So therefore, we have to supplement B12. Now, some people can get away with an oral supplement, either by way of a B complex or taking a separate B12 supplement. But many of those people, again, are not going to absorb it well. And so B12 by injection, either intramuscularly or intravenously, is a very good way to bypass the GI tract and get direct absorption into the bloodstream. The other source is to do what's called sublingual vitamin B12 replacement, or liquid vitamin B12 that you can put under your tongue, make it, again, bypass the GI tract and gets directly absorbed. So when I have patients who are on a good animal-based diet, maybe they're on a B complex, and yet their B12 levels are still low, then they're people that aren't absorbing it well, so we have to go to another route, be it intramuscular, intravenous, or sublingual. So we know where vitamin B12 is, why it's important, and I've explained why everybody, or many people I should say, are deficient. So what are we looking for in terms of levels? Well, first of all, it's very easy to get in part of your standard blood testing. The government recommends anything above 200 picograms per milliliter. That's actually an adequate level, but the truth is anything below 600 is going to be insufficient for doing all the different biological functions that B12 is necessary for. So it's recommended to have anywhere between 600 and 1300 as a blood level. Now, how do you replace it? Well, again, the government will tell you that 50 micrograms per day, even 100 micrograms per day may be enough for adequate replacement, but that's not nearly enough based on statistics and studies. Most physicians, including myself, recommend taking at least 1,000 micrograms of vitamin B12 per day. But again, what's important is to know, is it being absorbed properly? And if not, you need to get another route. But everybody should try out with an oral route, either by way of a B complex or a specific vitamin B12 supplement. So to wrap it up, B12 is one of the most important supplements, both to be measured in your blood test as well as to be replaced. Understand that if you're not eating a good animal-based diet, you're probably going to be getting insufficient amounts in your body. And even people eating adequate amounts of animal proteins, which is really the only good source of B12, are probably not going to have good levels based on statistics. And as I said earlier in the video, upwards of 80% of people in this country have some level of deficiency of B12 for the many causes I mentioned. So look to have B12 as one of your most important supplements. Make sure you're doing in proper dosing, as I mentioned, which would be anywhere between, let's say, 1,000 and 1,200 micrograms per day. Make sure you're getting it checked in your blood level, because again, at the end of life, we're seeing a lot of things like dementia, decreased brain function, as well as the other things I mentioned. And even in the early part of life, one of the reasons that in a prenatal vitamin B12 is so important is because for normal development of a growing child, B12 is so inherently important. So I hope that helps. Add this to your supplement stack, as they call it. And so stay healthy, well, and I'll see you on the next video.